So diagnosis is always both central and challenging. And what happens even now, although somewhat less, is that someone has to notice that there's a problem. Usually what happens is that a child, a boy, is clumsy or aggressive or intrusive, and that becomes noticeable. So, as Rochelle said, the best data suggests that the ratio of males to females is about 2 to 1, but the number who are diagnosed in elementary school clinics is much greater in the preference to males to females. So it can be as few as 10% of children with ADHD are girls in many places, or 20%. And what that tells us is that a very large number of girls are being missed, and a substantial number of the quiet, spacey boys are missed until the problems become greater and greater, until the kind of demoralization and self-fulfilling prophecy that it's not going to work out, that I'm too dumb, that I can't make it, become more deeply set. So that's the struggle, is that if one looks for it, then you have to go through this careful process of thinking about what might be going on. It's rare, it does occur, but it's rare that ADHD is the only condition. So you have to consider learning disorders, which are present about half the time. You have to consider oppositional defiant disorder, conduct disorder, anxiety, depression. All of those can also be part of the whole package. And so it requires a fair amount of intense attention. But that's the first sine qua non, is someone has to raise the question of, could this be? And so it's, once one child has been identified, then it becomes easier to look for it in others, or in family members, et cetera. But it's that first one that frequently can be a tough one to get to.